Okay, yeah, so that's basically how the hind gut is forming. And these are like the different pathological things that can occur, as was stated in the lecture. And then the hindgut formation is pretty simple. So, okay, so basically the hindgut is going to be connected to this little area here, known as your, what do you call this, cloaca or allantois? Forgetting. Let's see. Okay, yeah, it's called your allantois. So it's like this area right here. Okay, so the allantois basically, right? It's gonna be like the meeting place of like your hindgut and your kind of like your urinary system. So it's kind of like your urinary system and your kind of like your defecating system, if that makes sense. They're gonna meet up at the allantois, which is this little sinus area here. You see it here? So what happens is that they're actually gonna close off. You're gonna get this kind of separation here. See it? You get a separation here, right? And that separation is brought about by your urorectal septum. And so now you separated the what? The hindgut from like your urinary system by the urorectal septum. So quick question. What is Meckel's diverticulum?
Yeah, outpouching.
Outpouching of what?
Ileum.
Okay. Specifically what on the ileum?
The vitelline duct.
That's right. Okay. What is a vitelline cyst?
It's like it's closed off at both ends to make the ligament, but you still have a bump in the middle.
And what is a fistula?
It's open.
Okay. What would you expect in the case of having a vitelline fistula? What would be the complications?
You have stuff from your intestines coming out.
That's right. So it'd be pretty straightforward, right? So, what was the case called where we had a problem with the ventral pancreatic butt?
Annular pancreas.
Okay. What degrees was the midgut rotating?
270.
What was it rotating around? Around what axis?
Vertical?
Around what axis?
I don't.
What does it rotate around? It rotates around something.
The midgut?
Yeah, the midgut rotates around something.
Oh, I know. And I can see it. I don't know what it's called.
Superior mesenteric artery.
Okay.
Okay, so what is the orientation of the rotation? What's the orientation like?
Counterclockwise?
Counterclockwise. What happens if the midgut herniates through the umbilical cord and doesn't regress? What is that called?
I can't remember.
So umflacile.
Umflacile.
Okay. So the hindgut formation is just before you're gonna have the hindgut connected to like your urinary system, and you have something called the allantois. So what happens is that you have the urorectal septum. Your urorectal septum separates the two, and then you have your hindgut by itself. And that's really all you need to know about that. And then the other thing is that when you're looking at the primitive gut tube, at some point a lot of the endodermal cells are going to like proliferate rapidly, and they're going to like block up the whole tube. Then what happens is that later on you get recanalization, meaning like you get like apoptosis and the cells die and stuff, and so you get actually form a lumen. But what happens is that in certain areas, this might not be successful, so you might have some stenosis occurring there. That's what this is saying. And then remember that the lungs are forming what? From
the lung bud.
That's right, the lung bud coming off the gut tube. So the thing is that the lung bud has to pinch off of the gut tube. It has to completely separate. But what happens is that you might have incomplete separation. And you might end up with, so this is the gut tube, and this is like supposed to be a part of the lungs. So here you have a continuation of the distal part of your gut tube with, I guess, your trachea here. So you have a tracheal, esophageal, fistula, and which was important to take note of. So that's basically it. So quick question: what forms the separation between the hindgut and your urinary system? What's going to form a separation between the hindgut and the urinary system?
Urinary rectal septum.
Urorectal septum.
Urorectal.
Urorectal septum. But yeah, this is all you need to know for this lecture.
Okay.